Hello, everyone, and welcome. I guess we'll give it a few more minutes as people are joining in. I do invite those who are have been here before and everyone to put your name and any introductory information in the chat that you'd like to. We'll give it about one more minute or so and kind of go from there. Welcome, Ms. Backley. We're happy to have you with us today.
Thank you. I'm delighted to be here. Thank you for having us.
Oh, you are very welcome. Thank you, Dr. Link and the Terrapin think tank students for joining us today. Please introduce yourselves in the chat, and then we'll have an opportunity for people who are joining us for the first time to introduce yourselves as well. Hi, Caitlin. Good to see you.
Hello, hello. How are you doing? Good to see you, Dr. Slade Martin.
Yes. Oh.
Your pitch for the health equity work group at the last quarterly meeting was just so good. I was like, how could I not show up?
Well, thank you. Look, nervous energy helps us every time, right?
Oh,
So,
if you were nervous, I certainly didn't know. I was like, man, I have never been more excited about a work group before.
oh, I'm glad. Well, I'm glad. I'm glad that that brought you out. Great, great. Well, Kim, let me know. Should we get started? It looks like we have a good number of participants here.
I think we're all set.
Great, great. Well, I'm Phyllis Slade Martin, the co-chair of the Health Equity Work Group, and I just want to welcome you all here to our monthly meeting. Again, I am very excited to welcome the students from the University of Maryland Terrapin Think Tank and Dr. Marilyn Link, who's joined us as well. Hi. So glad to have you and your support. And so what I'd like to do is just encourage everyone to do a quick introduction in the chat. And again, just welcome everyone. We have quite a sizable group today, so we're excited about that. And one of the things that is always exciting, but sometimes the problem, we have great volunteers that are working with our health equity work group, and we had Ari Holland Baldwin is our latest co-chair, and she just got a job outside of the county. And so Holland, Ari is moving on to her new position. She served us as the data and assessment subcommittee chair, and she served most recently as the co-chair. So we just want to give a shout out of appreciation to Ari, and to let some of you know, maybe for the first time, that she has moved on to it sounds like a great new position outside of the county. So we just want to show this certificate of appreciation for Ari and recognize the service that she did for the Prince George's Healthcare Action Coalition. So yay to Ari, and thank you for her work. I also want to just do a brief recount. We have quite an agenda for today. I think a really exciting agenda for today. And so as I'm clipping along, again, please introduce yourselves in the chat. Welcome all new people. As we have a sizable group, we won't, a sizable group at a sizable number of agenda items, we won't do as much related to introductions, but we do welcome you all today. And so a summary and a recap of our previous meeting is we had a great discussion in January's meeting about the Health Equity Champions curriculum modules. And what we had, we did was we had 4 individual groups that focused on the 4 key modules that we've decided to adapt. And we looked at the Project Share curriculum, which is largely designed for high school students. And that's with the University of Maryland at Baltimore County. Now, there's a link to that in your agenda that Kim sent out. And so what we did in our last month's meeting is have reports on ways that we could consider adapting that curriculum to what our needs are in the county and what our interests are in the county with the Health Equity Champions program. So some really good work and some initial critiques and analysis of the Project Share and how it applies and things that we might do differently. So that those reports were done in our last meeting. There are some quick notes that I want to share because we're going to do some work later in the meeting. And so out of those discussions, there were some general considerations and recommendations. And some of those looked at training and could possibly be done in a hybrid situation, some in person, some online. Looking at the possibility of self-paced options, having a knowledge check, a pre and post knowledge check for people who went through the, who will go through the Health Champions program, training program. Looking at recruiting participants and drawing from our collective interactions with the county. So we have people like Dr. Thomas, who works with beauticians and barbers and others, and other coalition members who have relationships with people in the community and in agencies. We need to determine the number of sessions that we are interested in, the length of those sessions. We'll have some discussion in small groups tonight about that. Deciding if we want to have optional reading, homework videos, and how that plays within the class structure. Certainly having some kind of certificate of completion recognition for those who go through the program, and ensuring that the activities are interactive and relevant to the county and the audience that we're looking at. So those were some of the key things we looked at. And so now I believe it's Dr. Hancock with us tonight. Dr. Hancock is our county council liaison to the Board of Health, and she meets with us each month. And so there's such a long list. Is Dr. Hancock with us? So we will pause, and Kim, if you can just update and let me know when she joins. We can have
Okay,
her.
will do.
Okay, we can have her to present after our wonderful presenters tonight. So I want to take this time to welcome Mary Backley, the CEO of the Maryland Dental Action Coalition, and Charlotte Hager, who is public health consultant and director of the Maryland Dental Action Coalition's Medicaid Adult Dental Care Collaborative. And they're going to give us some updates and tell us what's happening and how we can encourage people to be a part of and take advantage of some of these resources. So welcome, welcome, welcome. And I will turn over to Mary and Charlotte.
Thank you.
Thank you so very much. We are so excited to be here, and I want to thank you all for your great work, your tireless efforts and your work in Prince George's County, and the opportunity to be here today. We are so excited about this new program that started January 1 of this year. It's been a multi-year effort to get to this point. And so we really have an opportunity to have such a profound impact on the lives of just so many adults in Maryland and Prince George's County. And so we're here to tell you and talk to you about the program and how you can help, how we can help these adults get the access to the oral health care that they need. It's an incredible milestone, probably our most significant one since our incorporation. And so I know time is limited, and I want to start this presentation by giving you a background on the Maryland Dental Action Coalition, who we are, how we evolved, what we do, and then we'll really get into the Medicaid adult dental coverage. So, we believe all Marylanders need and deserve access to oral health care. Our purpose is to improve oral health equity in the state of Maryland. And Charlotte is my tech person today, so she is moving the slides for me. Thank you, Charlotte. Oh, whoops. If we can go back and up one, Charlotte, that would be great. There we go. The Maryland Dental Action Coalition is a nonprofit organization, and we're here to improve the oral health of all Marylanders, as I said. And we focus on doing this through increased prevention, education, advocacy, and access to oral health care. We started, really our precursor was the Dental Action Committee, which was formed as a result of the very tragic death of Diamante Driver in 2007 due to an untreated dental infection that spread to his brain, and he tragically died. And the Maryland Secretary of Health, as a result, formed the Dental Action Committee in response to that and in response to the mounting concerns about access to dental care for low-income children. And the Dental Action Committee came up with recommendations to ensure that, frankly, this never happened again. And that really focused on Medicaid reimbursements, public health strategies, a very robust oral health education and outreach campaign to parents and caregivers, increasing provider participation to ensure that there were more dentists seeing children, and as well as improving and expanding on the scope and practice of the dental profession. In 2010, MDAC was formed, incorporated as an independent network of partners and stakeholders to watch and monitor the progress of the implementation of the DAC recommendations, and to really focus on outreach and expanding the care to a broader audience of Marylanders. In 2011, we were incorporated as a 501c3 organization, and we lead the state in the development with 60 organizations statewide in the development and writing of the Maryland Oral Health Plan, which really is a blueprint to improved oral health in Maryland, that addresses oral disease and injury prevention, oral literacy, and access to care. Because of our very proactive, aggressive campaign to improve the oral health of Maryland children, Maryland has exceeded all objectives in healthy people related to oral health care of children of 3 to 5, and we're looked at as a national model. And in 2015, we turned our attention and focused on adults, because in 1992, the Medicaid adult coverage was eliminated from an option for Maryland adults. And I shall turn this over to my colleague, Charlotte, who is going to walk you through our campaign now to implement this incredible legislation that passed in 2022, calling for comprehensive adult care for Maryland. Charlotte?
Yeah, thank you so much, Mary. Can y'all hear me? I think we're good.
Yes.
Yes. Sorry, I'm working with Teams across my computer and my monitor, and so just making sure everything's doing what it needs to. So thank you, Mary. That's a lot of what Mary was kind of leading into, is what is really bringing us around today and why we're actually connecting with care coordination and health equity groups all over the state, is to really talk about this amazing Medicaid oral health benefit that has come into play, and making sure folks know what it is, how to access care, and other information they can share out to their communities they're working with. And so, as Mary said, not only was this an expansion of just Medicaid oral health care, it was really looking at holistically, what sort of policies were in place and what things can be expanded in 2022 to help further benefit Marylanders. And one thing that came out of the legislation last year was that, actually effective as of April of last year, any Medicaid eligible pregnant person was actually able to access full Medicaid benefits. And this is inclusive of oral health care from not only during the duration of their pregnancy, but also 12 months postpartum. And this is really critical when we look at Maryland as a whole and look at pregnant folks, and understanding that Medicaid is easily covering around 40% of births throughout the state, and folks that are having birth are actually going into nearly half of infants being born in Maryland are being connected with the WIC program. So why it's so critical to really keep expanding access to oral health care and healthcare in general to all Marylanders. And this is something we're going to talk a little bit more of towards the end of our presentation, but really understanding that integral link of oral health care to overall bodily health and well-being. I think actually one of our community collaborators once said, it's kind of ridiculous because people think that the mouth is separate of the body, when in fact, oral health care can really have a detrimental or incredibly positive impact on our bodily well-being. So really making sure we are linking those initiatives, we're linking those services, and we're making sure that oral health care is central to overall medical services we're accessing to feel good. And so before I jump into this new expanded benefit to all adults in Maryland with Medicaid, I want to talk about really a little bit more of what brought us here today. And so Mary briefly touched on this, that this was years worth of legislation and expansion of coverage, but part of it was built out of what was called the Adult Dental Pilot Program. And I bring this up because this really set the foundation for the benefits that we see today. So back in 2019, legislation was passed to implement this pilot program, and it was geared towards adults in Maryland that are considered dual eligible. So that means they are dually eligible for both Medicaid and Medicare. It's around 33,000 adults throughout the state. And these adults were able to access a more basic form of oral health care. they had up to $800 that they were able to spend per year to access this oral health care. And this really helped, again, set that foundation of like, are folks going to be utilizing this care? What sort of issues come up? What are considerations that need to be considered not only for the patients, but also the providers who are providing the oral health care? And so what we learned over the last 3 years is that nearly a quarter of these eligible adults are actually accessing care, which is superb. I know 25% might sound low, but that's on par with the national average. So this is showing that when you put the services out there and the accessibility, folks are going to utilize that care. Maryland Medicaid has actually paid over $5 million worth of dental claims. So this is ensuring that providers are actually getting reimbursed at a pretty significantly high rate for our state compared to across the nation. And what was cool was that MDAC, our organization, was actually able to help spearhead, throughout this pilot program to really see, okay, what's going on? What are the resources out there? Making sure that the member directory through Maryland Healthy Smiles, is it up to date, or do we have all the providers listed? Are the services that are needed? Conduct patient outreach to see, okay, if these services are out there, how is it going? What are some things that you like? What are things you don't like? And also another thing that we did last summer, which really led to building out a lot of resources that I'm about to talk to you about, is that last summer we actually did a pilot test social media campaign. So we built out messaging, 2 iterations of it that we disseminated all across Facebook. And part of it was just to put that information out there, like, hey, folks, if you fit in this category, so folks with Medicaid and Medicare, you're eligible for basic dental health care. And it was a really successful campaign. We had over 120,000 Maryland Facebook users actually engage with the campaign. And it really taught us that folks were looking for information around their benefits. They weren't sure exactly where to access care, what those services looked like, or even how to check their eligibility. And so that was like one of the big emphasis of doing this pilot social media campaign last summer, was knowing that legislation was going to get passed to expand oral health care access. We wanted to make sure we understood what kind of information folks were going to look for. And so that brings me to the yay, really exciting announcement. Thanks to many, many years of collaboration and partnership, legislation was passed last year, which came into play as of January 1st of this year, that any adult with Medicaid, we're talking 21 and up, now have access to comprehensive oral health care. Yay, round of applause. And as we talked about, and we'll keep reemphasizing, our mouth is part of our body. So this is so critical to overall health and well-being. So what does this look like? So this means that adults, like I said, 21 and up, that are eligible and enrolled in Maryland Medicaid have coverage for comprehensive dental services. And this is through the Maryland Healthy Smiles dental program, which is out of Maryland Medicaid. And what's great is that legislation ensured that there's no annual cap of cost. So as we talked about the pilot program where folks only had up to $800 to spend, there's right now currently no cap of cost of services. So that means our clients, our community members, our neighbors, our friends, anyone who has Medicaid can access finally after 30 years, the oral health care services they need without the limitation and concern around costs. So this is going to include a lot of basic preventive care as well as more of expansive periodontal care. And so this is listing out some of the, overview of services. It is important to clarify at this moment that dentures adjustments are included, but dentures themselves are not included under services. But again, we're only 2 months into this, so let's see how, this program keeps evolving. So part of our initiative again today to come to you was that because this legislation is in play, this now expanded coverage is out there across the state, we're trying to connect with folks throughout the state, throughout various communities and groups to let them know that this is there. And what tends to come up and what came out of the social media campaign is that folks were confused when it comes to their healthcare benefits to understand if they're eligible, what sort of services are covered, and where they can access care. I know I have no idea about my health insurance and what's covered. So we wanted to take that feedback we had gotten from that social media campaign and bring it into this informational landing page. So if you're looking at your computer now, you can scan our fabulous little QR code, and it will lead you over to our informational landing page that we have built out specifically geared towards this benefit. And then there's the URL at the bottom. We talk about the benefits, the service covered, how you can find a dentist, and I'll walk you through that in a second. Transportation assistance. So actually, Maryland Healthy Smiles has set up a list of transportation assistance per county. So we recommend looking at that list. Ways to check eligibility, to learn about your benefits, and then we have some informational flyers too. It's exciting. So something you'll notice on this landing page are we have 3 different little buttons towards the bottom of the page, our little call to action buttons. And this is a way to more directly link you to Maryland Healthy Smiles and the resources that they have. Because again, you know, here at MDAC, we're not reinventing the wheel. We're just trying to provide clean, clear, concise information around the benefits and then link you directly to the places to find that final clarifying information. So, you know, as I mentioned, folks were curious, like, hey, how do I check my eligibility? And the best way to do that right now is to actually directly call the Maryland Healthy Smiles customer service line. So that phone number is included, as well as if you click the check eligibility button on our page, it's going to lead you back to the main landing page for Maryland Healthy Smiles, where they also recommend you call. That's right now kind of the best way to handle it for the way the system is set up. The second piece is, all right, so folks find out that they're eligible and they want to find a dentist. So there's 2 ways to approach this. So one is that Maryland Medicaid has sent out, so now we have, you know, almost 800,000 adults here in the state who are eligible for these benefits. So they have sent out a new updated card at the beginning of the year. We know we're learning slowly on the ground that they're kind of trickling in, and that this card should have listed on there a dental home. So a local dentist within that zip code where that patient, that person is located, where they can connect to that dental office. Another way that folks can do it is literally going on the Maryland Medicaid, Maryland Healthy Smiles page. You can put in a zip code or by your city and address, and it will pull up a provider listing within that area. And then if any folks need more detailed, nuanced information around the benefits themselves, our last button, Learn More, links you directly over to the member handbook. This does get updated relatively annually, and it's available in other languages. So again, you know, we're using our landing page as this kind of starter point for you to just kind of get you that clean, clear, concise information, just really simplify it, you know, get you directly to the point, and then from there, link you over to more information. What's also great to know, and because I see that we have folks connected to all different programs in this meeting, is that we've built out these digital one-pagers. So we have them in both English and Spanish. We're going to be reaching out to folks at some point about possible prints if you need them in hard copy. So always feel free to reach out to ask about that. But this is a way too that you can send this among email listservs or, you know, other email groups or post it online, and that folks can just find, again, that clean, clear, concise information around the benefits. And so, like I said, we are about 2 months into this, and we know that this is really exciting. There's a lot of people hitting the ground doing the work. We're getting it done. But we also know that there's going to be some challenges as well as opportunities. And so I'm going to switch back over to Mary and let her kind of expound upon that a little bit more.
Thank you, Charlotte. I appreciate that. There are definitely some barriers, some issues that we are facing as we launch this program. There is a health professional shortage area, just like in other states throughout the country. There is one in Maryland. In rural counties in Maryland, it's particularly an issue. There's about, as it says on the slide, about 4,200 dentists, but only about 29% participate in Maryland Healthy Smiles. So we're really working with our colleagues, with the State Dental Association, with the Dental Society, to recruit additional providers to participate in the Maryland Healthy Smiles program. 800,000 is a lot of adults. Now, not all of them will seek care, but it is most certainly a tremendous addition to the Medicaid program. We were really pleased that Medicaid provided $19.5 million in the 2022 budget to increase reimbursement rates. We looked at that as a wonderful incentive to keep Maryland providers in the Maryland Healthy Smiles program, as well as recruit others to participate. That was the first such increase to Medicaid in nearly a decade in reimbursement rates. And I am really pleased to say that we just learned that the 2023 budget has an additional $20 million allocated for Medicaid dental reimbursement rate increases. So there is complete recognition by the Department of Health for the need to increase reimbursement rates to incentivize providers to participate in the Maryland Healthy Smiles program. It's wonderful, and it's something that we are going to continue to advocate for in terms of bringing reimbursement rates continue to increase to provide incentive for providers to sign up. We also were participating in a Pathways to Bright Futures program in coordination and collaboration with the Maryland Department of Health, Office of Oral Health, as well as many partners throughout the state, which is focusing on health professional shortage areas. And the program is to connect to youth living in those areas and provide them a pathway to dental profession, create experiential learning opportunities, provide scholarship awards, and as well as provide externships with the University of Maryland School of Dentistry in an effort to get them or interested in the field and hopefully study the field and practice in the area where they grew up and return to that area and serve and treat the community. So we are very cognizant of these issues, of these challenges, but the network, our partners, you, the department, we're taking this on. So go ahead, Charlotte. Now, we have referenced several times that oral health matters. We have referenced several times the connection between oral health and overall health. And I really highly encourage you, many of you are so aware of this and speak of this, about the connection between oral health and overall health, as well as chronic conditions. Untreated gum disease makes it harder for people with diabetes to manage glucose levels. Oral health and heart disease is connected by the spread of bacteria from the mouth to other parts of the body through the bloodstream. People with gum disease are less likely to keep blood pressure under control. And with regards to what Charlotte was talking about earlier, the importance of extending dental care postpartum to 12 months as well as prenatal, I can't emphasize enough the importance of dental care prenatal and postpartum. Gum disease among pregnant women is associated with adverse birth outcomes such as preterm low birth weight and premature births. And we really are working hard to integrate oral health care into prenatal and postpartum care. So oral health is oral health is health. It's all overall health. Go ahead, Charlotte. And actually, good oral health, a healthy smile is a happy smile. You feel good. You feel good about your smile. You feel good about your self-confidence. It increases your self-esteem. It's particularly in adults. It has an economic impact. People are able to work, able to get a job, able to retain a job. In school, it keeps children in school. It is impossible to learn while in pain. It is absolutely impossible to learn. So it has such an impact on the totality of one's individual health, well-being, and self-esteem. So I encourage you, when you speak with your colleagues, when you speak with clients, when you speak with organizations, emphasize healthy habits. It doesn't take a lot of time to relieve yourself in terms of any potential future pain and issues. So, and this is something we always go out and advocate with our organizations that are part of the network, with area health education centers, with local health departments who do an incredible job with their clients in advocating and dental and promoting good oral healthy habits. So I know time is limited. You have a very big agenda, but we are so excited about this program. We want to thank you, many of you who participated in this effort, in our advocacy. It was really quite an incredible year, and we're really looking forward to having the adults get the care they finally deserve.
And I want to throw my little pitch in there as well, since we have so many college students who I saw logging in. We are always looking for folks that are super interested in taking on internships and practicums and opportunities like that. So if this is something that you feel really jazzed by, please email us. We would love to hear from you. So I just want to give my little 2 cents there.
Thank you, Charlotte. And thank you, everyone, for the opportunity to be here today.
Thank you so much. That was an excellent presentation, and thank you for your activism. I want to thank Kim for her work in helping to bring you here to the meeting. So let's give them a round of applause, a shout out, everyone, because this is a major breakthrough, and I like the way you're simplifying, keeping it simple.
Yes.
And so I'm doing some outreach for the Health Leap Project tomorrow, and I will print out some of these flyers to take with me. So that's great. Yeah, great.
Thank you.
Let's take just a couple minutes. We have maybe about 3 minutes to do some quick questions. If we could, if you have questions, you can either write them in the chat or jump on and ask any questions that you might have.
I think we have somebody with their hand raised.
Good afternoon. This is Shanika. Hi, Mary.
Hi, Shanika.
Hi, how are you? So
terrific.
I've landed in Prince George's County, so we definitely need to link up so we can kind of bring some of those same efforts here to this county. I'm in the same capacity, just a whole lot more people. So let's get together so we can get our care coordinators and those outreach workers up to speed on what's going on with dental.
Fabulous.
So
I look forward to it, Shanika.
All right.
Great. Are there other questions? Any other questions? Great. Well, thank you all so much. Thank you for that excellent presentation, and again for your activism in making this happen.
Absolutely. Our sincere pleasure. And we put the email in there if questions do come up, or especially if you are finding folks that are trying to access care and they're having challenges or maybe even successes. We'd love to hear that. We're part of like an ongoing communication with Maryland Medicaid. So we definitely want to hear what's happening on the ground, and understanding this is year 1. So hopefully we'll see a lot of successes.
I think we do have another question. We have time for another question.
Thank you so much. Hi, everyone. Tegan McGuire from University of Maryland. Thanks, Charlotte and Mary. Super interesting campaign, and congratulations. I have a question related to the slide that you showed about the capacity of dentists right now, and sort of the disparity between payment between private insurance and the Medicaid. Are you all anticipating sort of a large wave of volume with this new launch and sort of the promotion and education campaign that you're doing? And do you think there may be any issue with access based on the number, or how will you handle that? Or do you think it will not be a problem? I'm wondering if people become aware and are really excited and then try to get in, but dentists are already unlikely because of the payment to want to take patients. And then patients are suddenly becoming aware if there may be friction there, or if you've thought about that.
We think about it every day, and thank you very much for your question. That is a concern about from the providers, as well as the care coordinators. Are the providers there? Is there a sufficient number of providers available to be able to serve this huge addition to the Maryland Medicaid program? And that's why we've been focusing and working with the increase in Medicaid reimbursement rates. 40 million over the past 2 years is very helpful to the incentive to incentivize providers to sign up for Maryland Healthy Smiles. it is something that we are addressing. We haven't heard major issues, but Maryland has 62 health professional shortage areas throughout the state. And it's something, according to a Kaiser Family Foundation report last year, in order for Maryland to really adequately serve the population, they need a minimum of about 400 more dentists. So that's why we are working with our colleague organizations, the State Dental Association, and working with the Maryland Department of Health to implement programs that would bring students into the profession at a younger age. And it is a concern. It is something that we are hopeful to address through a number of different avenues.
Thank you so much.
Thank you for the
wishing you
question.
lots of success. Thank you again.
Thank you again. Thank you again. I don't know if Dr. Hancock has been able to join us.
I think we have there might be 2 more questions.
Okay, we'll do those quickly. Dana and then Kayla.
Yeah, good afternoon. Thank you so much for the amazing presentation. This is really great. I just have one question about the efforts regarding oral health for kids. What is your, how do you have any plans to, expand, the oral health care for children in Maryland, and if there is any path you are pursuing in that regard?
We made great strides with oral health care for children prior to our campaign on adults, and it is something that we continue to pursue. We are working with Head Start in terms of incorporating oral health literature and education into the programs. We provide information to WIC in order to communicate and coordinate and get together with families in the program and educate them on the importance of oral health, to especially good oral health behaviors when a child is young. We also just learned today, actually, that the Maryland Department of Health is going to reimburse for silver diamine fluoride treatment. That is something that is a good preventative measure to stop tooth decay, to stop cavity development. Dental caries is the #1 chronic disease among children, so that's something that we have been really strongly advocating for, and we're happy to see that the department is going to reimburse for that. So while we did oral health for adults, we did and continue to pursue expanding oral health literature and education for children and parents.
Thank you. Thank you.
Thank you. And Kayla, we'll give you the last question. And Charlotte indicated in the chat, if there are additional questions, you can email them directly. So let's hear from Kayla. We're not hearing you, Kayla. Check to make sure you're not muted. Okay. Kayla, if you want to, you can, again, reach them directly. For some reason, we're not hearing you. So thank you all again. Another round of applause. And I don't know that I've seen Dr. Hancock with us, so we'll go to our next activity. Thank you all again. Okay, so what we are going to do now is, you've heard us talk about the Health Equity Champions program and activities. We are determined, and we have taken this on as one of just a couple of our major initiatives for this year's goals. And so I won't repeat anything again about the Health Equity Champions program. We've talked about it quite a bit. what we are going to do tonight is, as I mentioned before, we had some discussion in the previous meeting about how we might adapt the program, some things we need to consider in adapting the project share model and curriculum to working with community members in Prince George's County and training volunteers in Prince George's County. And so, Kim, I'm going to ask if we have people who can lead from each of the categories. I think hopefully everyone is here with us today. And so the 4 modules that we are focused on for the Health Equity Champions program that we again adapted from the project share out of the University of Maryland, Baltimore County. One, we want to ensure that we do an overview of health equity, that we look at quality health information and health literacy, that we look at crafting, prepare the participants to craft and deliver messages, and to promote health and wellness in your community. Those segments. You all are welcome if you haven't looked at the Project Share curriculum. Kim had included that in the agenda for everyone to take a look at. And so the exciting news today is we're going to break into work groups, realizing all of us are stretched in doing a gazillion things, right? So we're going to take time in the meeting today to have each group to meet to discuss lesson plans. What kind of things should we consider for lesson plans? You heard me earlier talk about some of the general things that we want to consider with the curriculum in general as we're working with adults in the Prince George's County community. And so we're focused on the content for training our health equity champions throughout the county. And so, again, these 4 modules are the modules we've talked about. And so each will have 4 breakout groups tonight. The first is led by Christine Stewart. Is Christine with us tonight?
I am.
Yay. Hey, Christine. Yeah. So we have the first module. Christine has done phenomenal work on health equity, right? And she's done really good work on giving synopsis of the Health Equity Champions program, which we've used many times in this meeting. And then module 2, we have quality of health information led by Dr. LaRue and Kim Stinchcomb. And we are so pleased to have her. And I think tonight we also have Suyana Barkley, who will be a part of the discussion, all of whom have done really good work related to health literacy. And then module 3, we have crafting and delivering the message. And thank you to Taryn Shaw for leading the discussion. She worked with Ari Holland Baldwin on that first phase of the review of this module. And module 4 will be Sharon Zaleski is actually going to facilitate and lead our discussion. And I am also the facilitator of the discussion, but I'm asking Sharon to take the lead in this group because I think I've talked enough throughout this meeting. And we focus on promoting health and wellness in your community. And so each of the facilitators have a guide sheet. However, our major objective is to look at what kind of things can we should we include in the lesson plan? We're not creating the lesson plans tonight, but just talking about what should we include and consider for the lesson plans. What kind of resources, definitions, content should be included in the lesson plans. So each facilitator will give a quick overview of where we are with the modules, and then have some discussion about some of the kind of contents. Now, the thing I'm really excited about, and I've said this probably about 3 times during the meeting, is that we have University of Maryland students with us tonight. And we are going to take our wonderful notes from our discussion tonight and hand them over to the University of Maryland students who are going to do some of the first drafts of our lesson plans. So we are moving this thing forward, and we're really excited. And so, Kim, any other instructions that you have? And we're ready to go. We have about 30 minutes, so we're going to take the bulk of 30 minutes in our subgroups to have these discussions.
Hi, everyone. Thank you all again for joining. And yes, special thanks to all the students that have joined tonight, either through a class or through the Maryland Think Tank. We really appreciate having you on. I am currently experiencing a minor technical glitch with the breakout room. So I think what I'm going to do to try to create a quick workaround is I'm creating separate Teams meetings. I'm creating separate Teams meetings for each module. And then after, maybe we can set a specific time to switch right back to this one. I apologize for the complication. Just give me 1 second to pull those links together, and I can put them in the chat, and you'll be able to jump into the meeting that for the module that you're working on.
And then to get back to this meeting, what will we need to do?
So to get back, what I can do is, I know I'll be leading with module 2, but I can hop out at time and remind everyone, time's up, and here's the link to get back to the original meeting.
Great, thank you.
Again, apologies for the technical glitch. I guess nothing ever goes, 100% perfectly.
That's okay, we're good.
All right, so. Module 1, health equity. I put your link in the chat.
Will people choose which group they want to join? Or are they assigned?
So, they're not assigned. I know that some people did sign up as interested in one module or another. Some people did sign up as interested in multiple modules. So if you did select to be part of multiple modules for tonight, we just want you to pick one to participate in. And I just put in module 2 in the chat.
I'm not, it may just be me. Is anybody else seeing anything in the chat?
I'm seeing the chat.
Okay, I think it's me because I was having this problem earlier today.
Christina, I can send you a link to module 1 in just a second directly.
Okay, no worries.
Are other people seeing the links?
Yes.
Oh, great. Okay,
yes.
Great. And so choose the one you're most interested in, and great.
All right, great. So I just put in module 4. So now all of the module options are available. I will go ahead and make sure to join each one so that they can get started. Feel free to close out of this meeting, and then we'll return at what time do you think, Dr. Slade-Martin?
In about 30 minutes. So we are, well, let's say about 10 till.
Okay, so returning at 4:50?
4:50, yes.
Okay.
I'm not sure if anyone can hear me, but I'm not seeing, I saw something in the chat, but I don't see the breakout rooms.
There's supposed to be links. I don't see it either. There's supposed to be links in the breakout room. I mean, it's supposed to be links in the chat to take you to the breakout room.
Okay, I see one link. It just says to learn more, and then there's the link to the website. But I don't see anything else, so.
I don't either.
I'm gonna try to, yeah, it's so odd. Okay.
I'm gonna look on my computer. I'm working from my phone, and I might be limited to what I can see. I'm gonna see what I can find on my computer.
Okay, I'm also on my computer, but I'm gonna message, I'm from the University of Maryland, so I'm gonna message some people from class. Hey, Charlie, sorry to bother you in the middle of class. I'm not seeing the breakout room option. Did you see that in the chat?
Yeah, it was in the chat. Full link.
I don't see, like, I see just people saying thank you for the presentation and stuff like that. And then is there a way that you could invite me to the breakout, or I don't even see that option.
You have the link. I'll log the link, but Tegan sent an email. Like Tegan, just put the link to Alice and Kareem.
On WhatsApp or
no, so contact Tegan directly and see if you see the link.
Okay. Okay, I will do that. Thanks, Charlie.
No problem.
Bye. Hey Tegan, sorry to bother you during class. I'm not seeing the link at all to get in the breakout room.
Hi, it looks like they're in the chat and you just press on
Okay,
the.
I don't see anything in the chat. So
Which one did you want to join? Because I can share it with you maybe.
Hey, Dr. White, this is Amy. I never saw anything in the chat, but Keegan was able just to send me a link to the room, so I'm gonna use that.
Okay, great.
Hey, you two.
Hi.
Hello.
Oh, hi.
We try to convince more people to help. Since I cannot help a lot, I did my little part of.
Great. Well, listen.
Kim is great. Kim is great.
Yes, isn't she? Isn't she? Listen. So listen. Thank you. Look, thank you all. I looked at our time and realized we might only have about 1 minute for every group to report. So listen, Kim, thank you for pulling that rabbit out of the hat and making this happen. We appreciate that. And thank you all for really hanging in there and joining in the discussion. So with about 6 minutes left, I'm going to ask the each of the facilitators, and we'll start with Christine. I'm going to ask each of the facilitators just to give a quick 1 minute about your discussion. Is Christine back in?
I don't see her yet.
Okay, let's go with group 2. Kim and Dr. LaRue and Suyana.
Sure. So for today, group 2 really hasn't had an opportunity to meet yet in the past. So we took the opportunity today to really just discuss the goals of the health literacy section and start having the conversation around what information we want to add to the curriculum. So it went quickly, and we really just tried to focus on answering questions that we have around the curriculum program. I don't know, Sienna, did you have anything you wanted to add?
How was the day?
Good. So was upset, so she didn't really have an afternoon nap. But she
We're going to ask people to mute if they're not on Suyana.
Just 2 minutes, Suyana is speaking. Just to say, Kim, thank you so much for doing this all the same time, right? Because Kim is leading this group instead of me with Michelle. Michelle is not here today, and Kim had to do all the technical work. I think was the introduction of it. We review a little bit, and I think, as I mentioned to the group, I think we need support to move this forward, and health literacy, cultural competency, and also helping the champions to understand how to evaluate health information and make sure this is is this done in a way that people can really use to take control of their health is going to be very important, just to add that. But it's the beginning, and everybody is very welcome to help to develop the curriculum. Phyllis, you're mute. We're not hearing you.
Thank you. Let's hear from Taryn real quickly from group 3.
Hi, good afternoon, everyone. Taryn here. So group 3, we went through a good amount of the material, and we talked about making the presentation, making the class course more interactive, and also making it more relatable for the health equity champions. So a piece of the curriculum asked about that to look up great speakers, and it's what is a great speaker from what was suggested to what might be more relatable to our health equity champions. So in that aspect, making the curriculum more relatable to our health equity champions, and also more relatable to the targeted audience, and teaching and providing more detail on how they can tailor their message for the different audiences they're speaking to.
Great.
Thank you.
Great, thank you very much. Thank you. And Sharon, group 4. Thank you, Taryn.
So very quickly, I'm going to make a pitch. We really need students who are interested in policy to do some research and develop a primer on the structure and legislative process for the Prince George's County Council. We would also like for folks to develop a matrix of the county council members, what districts they represent, and any other, what committees they're on, and any other information that might be relevant to ambassadors who are encountering either in a formal setting or informal setting these delegates. So that's one piece. The other piece is we would like to do this for the state as well, and I expect that there is some existing advocacy primer on Maryland State, the Maryland State Assembly, but we would like that, and also a matrix for the Prince George's County delegation, because that's the most important to these ambassadors. So there are two really clear, concrete research projects that we would like to have done, and these will live forever, except for the names may change, but the basics will stay the same. And then the other thing we would like to do is, for the introduction to this, is to develop a case study. We had spoken about using the health equity piece of legislation that passed and was never implemented last year, and to do research on what's currently before the county council to see if there are other health-related pieces of legislation, like food access, addressing food deserts, or addressing the number of liquor stores and cigarette sales in Prince George's County. And I would add to that, and I didn't ask Phyllis about this, but if there's any significant legislation related to violence and youth violence in particular, because, I think that's of a concern to everybody, and we know that public safety is often in the mix for the lion's share of funding.
Thank you, Sharon. Yay, that's good stuff. Thank you. I'm going to ask if everyone is willing to stay on a few more minutes so that we can wrap up. Christine, you want to do a quick 1 minute for your group? We are at 5, but I want to make sure we hear from you.
Yeah. So we started a little late. We had some technical glitches getting in, but we talked about wanting to start off by with clear definitions. So definitions of equity, disparity, equity versus equality versus justice. Wanting to make sure that the champions know and understand how social and structural determinants of health impact equity. So they have that context. We know there are a lot of graphics. So in terms of resources, there are graphics that can depict the differences between the three. We also need and want a bit of history of health equity in Maryland and Prince George's County, or like how those conditions came to be. This is a personal interest of mine, but Sharon, I hear you asking some of the students to like maybe take a dive into some of these things, and I think that is something I want. I haven't come across something that's existed that that would tackle that history of health and why health outcomes are the way they are in our county. But I also think there is a lot of interplay between like all of the counties, the region and Prince George's County. So it would be important anybody doing that type of research to kind of to look at the interplay between the three. So also we want to explore the specific cultural conditions that are specific to Maryland and Prince George's County. Again, to provide context, social determinants of health, I should say. And I think this was just discussed where we wanted and I had a feeling, Sharon, this is what you covered, understanding who the current players are in health equity and health in general that can impact, or other agencies who can impact health. We thought that was important as well, as long as it shows up somewhere in the curriculum. But first of all, like before we started, we posed a question like, who are the champions? So I mean, I think one thing that I felt strongly about was that it could be potentially somebody with no background in health, public health, or equity, and so we want to make sure that our curriculum could meet that person where they were and provide the context that many of us around this table, we likely already have that background if we're here. But one of the questions I could not answer, and we said that we would bring back to the group, is what is the age that we're targeting? Are we targeting an age? I didn't think that we were, but it was an interesting question because it may impact the way that we structure some of, it may change the format, may change other things. So it was something that I don't think has been discussed. And the group thought it was good for us to bring back to the larger group.
And this is a good place to, and thank you, Christine. This is a good place to say that there are other things that we have to flesh out. And so when we look at our next steps, one of the things you'll see that we have to define some of the curriculum logistics, some of the resource needs, the timelines, how we're going to implement, like, okay, so we got this great curriculum. And so what we want to do in our next meeting is talk about, all right, so where are the resources? How are we going to structure this and answer the questions? Now, I can tell you that in my mind, I don't know if we've talked about it, but we're certainly looking at an adult community initially of champions. We may change that, but as I briefly mentioned, there are, we would look at beauticians, barbers, the kind of people that we've been engaged with in some of our individual work, but absolutely looking at people who are more, who can be more advocates and are connected to the community. In fact, we probably are looking more at people who do not necessarily have any background in health. They could have some background in health, but it's not a priority. So we'll flesh that out and discuss some more. One of the next steps is we are continuing to work on this collaboration with University of Maryland Terrapin Think Tank, and we'll be getting some information to the students to begin to tease out some things related to the lesson plans, that kind of thing, and working through some of the details with that. I want to say thank you to everyone. This was really a great opportunity. I don't know if you have any community announcements you want to make, if you want to put them in the chat real quickly. But and I want to thank all of the facilitators and all of the participants for, getting us there. And again, big applause to Kim for making the magic work. So we appreciate that. And then the next quarterly meeting, it's going to be virtual. It's March 14th, Tuesday, March 14th. And our next health equity work group meeting is March 16th at 3:30. So be at this meeting because big things are happening. So, but again, thank you everyone for your participation and hanging in there with us as we went over. Have a great rest of your week, and we'll see you next month. Did I leave anything out, Kim?
Sounds good. Thanks for everything.
Yeah, thank you all.
Thank you.
Have a good one. Thank you.
Thank
Sheila.
you.
Thank you.
Here. Bye.
Oh, Kim, I have a quick question. If she's still on.
Christine, Kim may be off.
Yeah, she left. Okay.
Yeah. Christine, thank you so much. Thank you.
Okay.
Thank you all.
Do you want me to send my notes from my my group to Kim?
Yes, please. Please
okay.
do.
Yeah, it was a few minutes.
Okay.
Oh, Sharon, you're talking.
Sharon,
you're on mute.
Hi, Christine. I just wanted to remind you that there are, on the website, there are those two nice pieces on equity. one related to the Black population, the other related to immigrant populations in Prince George's County that have a historical perspective on all of the bills and things that impacted, and it's not just focused on health equity, it's also focused on just equity in general. But they're quite good, and they have quite a lot of information in them. And so I encourage you to look at and use stuff that we've produced so we could get credit.
Yeah, no. So absolutely. So are we talking about the PGC Health Zone website?
Yes, it's on there.
Hmm.
And if you go to the Health Equity Work Group,
yeah, we need some updates.
It's on there. It's just not readily easily apparent.
Oh, is it this?
Yes.
Okay.
I think, yeah, it's that, and then there's the immigrant one right next to it. Yes.
Okay. All right. I will take a look.
Yeah, they don't just jump out at you.
No, I mean, I knew there were documents. I actually didn't know the background, the content of the documents. So thank you. I'll actually link them in this guide just so we don't have to rely on somebody's memory.
Yeah. And I just feel like they haven't gotten the play that they really need.
Yeah. I wasn't involved in the issue brief, so thank you for reminding me. I will definitely put that in the link and put it in our document so we can use it as a reference.
Okay. I'm going to leave now. Goodbye, everybody.
Bye. Me too.